Hello friends, now we will discuss something related to lower abdominal pain. So as we know, the statistics part which we studied in approach to gynecology, which showed that almost 50% of the patients which you get will have lower abdominal pain. Correct, no? Now you should know an approach so that see, lower abdominal pain is a very broad term. You should know when it's a gynecological problem, when it's a GI related cause, when it's a musculoskeletal related cause, when it's a urological related cause. All those things you should know. For that you should know the statistics, and also you should know the basic approach of our anat physio and path. Correct, no? Now we'll talk about the statistics per se, which says that almost basically we can classify it as gynecological, GI, urological and musculoskeletal. So almost in this 50%, almost 50 to 60% or something related to gynecological cause. Okay, and remaining 20 to 30% are something related to GI cause. Okay, and remaining 10 to 15% are something related to urological cause, and remaining 5 to 10% or musculoskeletal. Now be with me for the entire video. I will show how to you approach a specific case with a specific age. Okay, in this is the major thing which we are worried about. So I want to touch upon even GI and other causes. So in GI it can be appendicitis. Okay, that in our approach I will say how do you say it's all these things. Okay, IBS, IBD, and also you might have constipation, all those things. And in neurological cause you might have UTI. What else you can think of? Kidney stones. Okay, then any cystitis. Okay, then here you might have any herniation of disc. Okay, or any myasthenia gravis or some disorders which affect the basic muscle. So this is not our part, that is not related to gynec, and we are interested only about 50 to 60% of causes related to gynecology. Correct, no? So in this case, no, now let us see what are the other conditions which you can see here. So in 50 to 60%, the first thing which I can think is of dysmenorrhea. This we have already finished. Then it can be pelvic inflammatory disease, also already finished under PV discharge. Then it can be a cyst, ovarian cyst. We'll discuss this under malignancy. Okay. Then it can be a ectopic, obstetrical related. Yeah. Then it can be a threatened abortion, or even torsion. We forgot that. Okay. So understand one thing, student. Why do you think I took this part at the last? We finished this. This we will finish it. And this is obstetrical thing which we will finish it later. These two things. Correct, no? So what is the what I mean to say is lower abdominal pain is a symptom which is presented along with other symptoms and never or least likely alone. Got it? This is the major take home message I want you to know. So this we discussed about the statistics part. Now the same anat physio approach which we follow for every subject, we'll follow it here also, because that's something which helps us. So now coming to our basic anat physio patho thing. See, anat physio and patho. If you know anat, you are 90% done. See, you know there are 9 quadrants. Correct. No, lower abdominal pain is these things, these 3 quadrants. Correct, no? So now we will see what are the structures present. You might have what? Appendix. Yeah, say me. Appendix. Then you might have colon, that is large bowel. Also you can have small bowel. Then here you might have kidneys. Then ureter. Then what you have? Urinary bladder. Then above that you have muscles. Correct. Now below this you have even uterus. So what is there to remember, man? All GI causes I dot. See, appendicitis because appendix is here. Then IBD because bowel is here. Then what else did I say? Yeah, basically that itself. Then related to urological cause, any kidney stones, yeah. Then any cystitis affecting the bladder, correct? No. Then any urolithiasis, yeah. And also I told there is musculoskeletal system. So if this is also affected, then you will have lower abdominal pain. Got it? So there is nothing. This is the approach we should know. If you know what are the structures, you will know. Physio, nothing much. You should know the pain pathway, why pain occurs. That I think I have dealt in other infection videos also. Go through that. Again in patho, if there is any infection, for example appendicitis, yes, basic thing. Then any chronic inflammation will never least likely come with lower abdominal pain, but chronic lower abdominal pain is possible in case of TB intestine. Then even if it's a case of malignancy or all those things, they can present with pain. So I emphasize you to know this approach well. Excuse me. So that you know what are the structures there, so that you can localize. Now very important thing about physio which I need to talk here is very important thing I cannot forget is about referred pain. Okay, cannot emphasize that point so much. See, I am interested in this series is about gynaecology. So what is and ops? Okay, what are the things now? If there is any pathology in body of uterus, okay, then it is referred to where? If there is any pathology in fallopian tube and ovaries, where is it referred? If in cervix, where is it referred? If it is in urosacral ligament, where it is referred? This is what you should know. So if it's in body, it is referred to medial part of thigh. Okay, this you have to remember. Okay, got it. Then hypogastrium region. If it's fallopian tubes, then it's above midinguinal point. Then here it's upper sacral and lower sacral ligaments. That is back. So why do you think I told this? See, if you are getting any kind of pain in this region, then that is implied that almost in 50 to 80% of the case it is something to do with gynecology. Correct? No? Then please don't say me if it's a male what to do. Come on, this is a female subject. Then 50% of your patients of LAP will be ruled if it's male. I am talking only with respect to female patient, and if you get any of the pain related to this, most likely gynecological is what I wanted to emphasize with respect to physiology and the referred pain. Got it? So now you know the basic approach. So what are the various things you can suspect, and what are the various things you should think of and where you should think of. Okay. Body of uterus is medial part of thigh and hypogastrium, fallopian tube and ovaries in the midinguinal point, then cervix and the sacral ligaments in the lower upper and lower back, basically lower back more. Okay, so actually then investigations, it depends on what you're seeing. In gynecology, basically radiological dominance, that is ultrasound, abdomen and pelvis is what we will do. Okay, even X-ray abdomen if you are suspecting any gastrointestinal causes like perforation, peritonitis, all those things. Then basic biochemical, your CBC to check for infection, inflammation, all those things, and also in UTI. And also you can do a urine culture if you suspect any bacterial pathologies things. Okay. Then treatment. Treat the cause. Okay. You can give NSAIDs if required. Basically first is for your advice, then treat the pathology. Got it? So this is the basic approach for your 50% of the patient, and you understood why I took this topic at the last. Correct? No? If I had taken in the first flow, See, we finished our 25% of menstrual problems, 13% of our PV discharge. These two usually come with our LAP. So that is 50%. So 25, 75, 83, almost 80 to 90% of your patient complain. Now you can come to a proper conclusion, and that's what I want you to take away. Okay, if there are various platforms for you to study the core diseases like fibroid, Asherman, all those things. My channel doesn't focus on that. The main funda of this is to get you to a clinical approach, so that you never miss out on patient how they come with. So you know the problem, you know the disease, you know the complaints now, so you know the workup. See, here there is no workup because I have taught you the workup of dysmenorrhea, correct? No, I have taught you the workup of PID. This we will discuss, ectopic will discuss in OPS, threatened abortion will discuss in OPS. So basically a lower abdominal pain, as I told, it's a symptom which is not presented alone, but it's concomitant with other symptoms. That is the problem, right? And never a patient comes with just lower abdominal pain, and if she is coming with lower abdominal pain, most likely she will go for a gastrointestinal department than a gynecological, correct? No? So you should know when to suspect. And I taught about referred pain, which is of paramount of significance to localize the pathology where it is, so that you know which part of the uterus is being affected. That is what is important, right? Now you know it's lower abdominal pain. Now we need to differentiate from the rest of the 50% of cause which constitute gastrointestinal and all your urological and musculoskeletal, correct? No? So for that you need to know the specific points and specific locations to ask for the patient, so that you rule out that. Then if you suspect gynec, then you need to do an ultrasound or X-ray based on the definite pathology. If in case of dysmenorrhea, and if it's a primary, you need not do anything, right? Even drugs is avoided in those cases. First an advice and conservative approach is something which you follow. But in PID, obviously you need to give antibiotics and stuff. If it's a UTI, then you need to start around antibiotics. So a tailor-made approach is required for a tailor-made disease and for a specific person. That's what I need to emphasize. And with this, I think 50%, and this is one important approach which I like you to develop for any diseases. If it's pain, if there is pain in any part of your body, think about anat. Forget physio and patho for a second, I mean it. Okay, so think about anat and think what are the structures which are involved, what are the organs which are present, what is the musculoskeletal structures which are present, what are the pain nerve sheets which are present, what are the blood vessels which are present. So based on that, so when you know the structures which are present, there is a pathology related to that, and that pathology can be an infection, inflammation, or a benign malignant condition, or any genetic or environmental related issues which is exaggerating the present pathology. Got my point? So based on anat, you can correlate with patho, then bring physio with hormones and neuroendocrinal things. So a correlation between anat, physio, patho is something which is very essential for all your clinical subject, and this is what you should. The main take home message for today's class is this. I don't care if you don't remember the statistics, and I don't care if you don't know the approach, but if you, at least by this video, if you take home with this message, that if you can think about if there is a pain in a particular point, and if you know what are the structures there, and if you from physio, if you can extrapolate the referred pain, I think I am done for this. I mean, I am satisfied that at least you know this part. Make sure your approach is right. Even if you are wrong, it's fine, but the approach which you go will fetch a lot of fame and name in a long run. That's what I wanted to discuss in specific to lower abdominal pain. By this we have completed almost, congratulations, 90% of your gynaec problems. Congratulations on that. So in this class we studied about the most presenting complaints of a gynecological department, that is lower abdominal pain. We discussed the statistics which made us to come to a conclusion that a woman with the lower abdominal pain will always have a concomitant other symptom, so that when to suspect a gynecological cause. And most commonly it can be a infection in a reproductive and sexually active female, and if it's an adolescent, most likely in case of dysmenorrhea. And if it's a reproductive case and if you are suspecting an adnexal mass, most likely a cyst or a torsion. And if she is a known case of pregnancy, then an ectopic or a threatened abortion is something which you have to suspect. This is the importance of statistics. Do you think I am mad to talk about statistics at the starting of video? No. At the end, you should come to some conclusion. Then why do you think? You are the government is mad to make a steady match from 1st to 10th and 1st to 12th? No. there are some points which you need to take away from each subject which you have learned from LKG or preschool. So that is the importance of carrying forward the particular subject throughout your life. It's not like after your MBBS you will forget, you just take up a specialty and you forget all. No, it's not like that. You need to take away some take home message from that particular video and you need to incorporate in every subject. Okay, so lower abdominal pain, this approach, if you understand how to approach pain, this is a basic approach to go with pain. So to visualize the structures which are there, the anat. And why do you think I talked about blood vessels and nerves? Is that I'll come to you, that will help you to extrapolate the complications. So those are the blood vessels. So if you are going to damage the blood vessels, hemorrhage can be expected from that particular vessels. And if you are damaging the nerve sheets or nerves, then loss of muscle weakness or limb atrophy or any nerve pathology, something which you expect. So if you know the structures which are involved, you know the structures which are getting affected, the pathology related to that, and you can even extrapolate the complication. There is nothing to remember. Okay, the only thing which you need to know is anat, except that the MBBS doesn't demand you to remember anything. So make sure you know that, then start extrapolating the things. Okay, then we talked about referred pain, when to suspect it's a gynecological problem, so that you need to exclude the 50% causes, that is gastro as well as uro. Then we talked about the basic investigations which you need to do. So most likely if it's a lower abdominal pain, if it's an adolescent, dysmenorrhea is what I would think of. Sexually active women, reproductive age group, I would think of any STIs or UTIs per se. Then a pregnant woman, PID, cystitis, or any torsion if you suspect an adnexal mass. And in older age female, if you are having lower abdominal pain, check for any mass. See, this is also one important complaint. They will never come to you saying I have a mass. They just say fullness. Okay, fullness with lower abdominal pain is something which is important. If you suspect this thing, then you have to do a per abdominal examination and you need to check for the consistency, surface, borders of that. Then you need to comment whether it's a benign or malignant based on your clinical experience and clinical acumen which you have gained in your MBBS life. Then based on that, you need to do a certain investigations, MRI or ultrasound or MRI, depending on the availability and the indication of that particular thing. Then you need to proceed. So remember, LAP with fullness, most likely a mass. So it can be benign and malignant. Older age, think of malignant, and it depends on your per abdomen. It's not like it's a thumb rule. It depends on your examination and it depends on your skills. Okay, so this is one of the basic videos which you should know to approach even pain. So I think we have discussed very briefly about lower abdominal pain in this class. I think that's it for this. So congratulations, you have finished almost 90% of your pain, 90% of your gynecological problem. Thank you.